Good afternoon, and welcome to another edition of Kidney Talks with the GW Ron and Joy Paul Kidney Center, MOTEP, the National Minority Organ Tissue and Transplant Education Program, and the Pennsylvania Avenue Baptist Church. My name is Jennifer Rigo with the GW Ron and Joy Paul Kidney Center. I am filling in for Reverend Dr. Kendra Curry. Today, we are in for a real treat, ladies and gentlemen. Our presentation will be on healthy living and spirituality. Love Yourself, Take Care of Yourself by Dr. Clive Callender. Dr. Callender is a transplant surgeon at Howard University Hospital and a professor of surgery. He also founded MOTEP, which greatly increased the number of minority living donors in the transplant world. And so he is a living legend. This is not an exaggeration. This is a fact. So you're in for a real treat today, because every time I hear this presentation, I make it a note to take care of myself. So Dr. Callender, without further ado, please take it away, sir.
Thank you very much. It's a pleasure to be with you today and to talk about a topic that is very dear to my heart. It begins with the first slide. Next slide, please, which identifies the fact that we don't have any things to worry about. Next slide, please, which addresses the number one problem in transplantation, which is the shortage of donors. Next slide, please. And next slide talks about the fact that we started off with our efforts in the 1980s, when the minorities represented more than 50% of people waiting, but represented less than 15% of the donor population. And most people thought blacks were not likely to donate. Next slide, please. And this slide identifies that it all began in 1978, when members of the Southeastern Organ Procurement Foundation came to me, helped me to solve the African-American donor shortage, but had no funds to support our effort. But because the data was so phenomenal, I presented this to Dr. James Bateman, an eminent psychologist, who reviewed the data with me and collaborated with me to figure out why African Americans were reluctant to be donors when they suffered end-stage renal disease more than any other ethnic group. Next slide shows that as a consequence of this effort, we obtained $500 from Howard University to survey 40 Washington, D.C. residents and identified, first, the 5 reasons blacks who were unwilling to donate, and secondly, and most importantly, identified ways to overcome their reluctance to donate. The next slide points out that the obstacles that we're talking about. They are, first, next slide, the fact that with the $500, we had a 40-person focus group. And this then resulted in a pilot study between 1982 and 1984. The next slide, please, which shows that the 5 reasons. First, a lack of transplant awareness. Blacks were not even aware of the fact that they needed organs more than any other ethnic group. Second, was religious misperceptions, thinking that they needed the organs and tissues in the afterlife. If you don't have your eyes, you won't be able to see God, and you won't have your heart, you won't be able to have your soul with you. And forgetting that it is in giving that you receive, it is in pardoning that you're pardoned. It's in dying that you're born to eternal life. And Christ said, it's better to give than receive. Next slide shows the third obstacle, which is a fear of premature death. Concerned that if I go to the hospital, they'd be more concerned with getting my organs and tissues than with saving my life. The next slide, please, shows the fourth issue, which is the medical distrust, the incidents in which minorities were abused by the Tuskegee event and many other such issues. And then the final issue, the next slide, please, is the issue of racism. Concerned that if I give my organs, they're only going to, and I'm a minority, they're only going to go to whites. And of course, we had to overcome these 5 obstacles. The next slide, please, which shows that this is how the waiting list has grown from the time we started in the 80s, 16,000 to now more than 115,000 people waiting for transplants. Next slide, please. This is a phenomenal growth, but While we have the list ever growing, we also are increasing the number of transplants. So that last year we did more than 40,000 transplants. But when you look at the difference between those who give and those who need, you see that close to 17 people dying every day because of the shortage of donors. Next slide points out that we developed methodology to identify the impact of the effect of our local grassroots efforts that began with the DC Organ Donor Program with the National Kidney Foundation and wound up with the Dow Take Initiative Program. And they all focused on increasing donation rates among Blacks. Next slide, please. And what was remarkable was that in every opportunity we had, the number of Black donors doubled, indicating that while people thought Blacks wouldn't donate, when they got the information, yes, they would become donors. Next slide, please. Points out that Gallup polls that were taken after we started the Dow Take Initiative program showed that there was a tripling of Blacks' awareness of transplantation and the number of Blacks signing donor cards. As a consequence of this, next slide points out that we decided that we should take advantage of what we identified with the DC Organ Donor Program and the Dow Chemical Company's Take Initiative Program and form the National Minority Organ Tissue Transplant Education Program in an effort to reach, the next slide will show you, all of the minority populations, targeting the Hispanics, Asians, African Americans, Pacific Islanders, Alaskan Natives, and Native Americans. This was established in 1991, conceptualized and established in 1991, more than 30 years ago. Next slide shows that basically our mission was to reduce the number and rate of ethnic minority Americans needing organ and tissue transplants, which we have seen to come to pass. Next slide, please. Which shows that our mission is to emphasize two aspects, not only intervention to increase donation, but also prevention, to have the adoption of healthier lifestyles and behavioral patterns, increasing the number of minority donors and transplant recipients, and increasing the number of family discussions regarding organ and tissue transplants, and increasing the number of minority donor pledges. Recognizing that adoption of healthier lifestyles and behavior patterns would decrease the amount of end-stage renal disease. The next slide points out that as a consequence of this, we've operated a total of more than 16 cities, actually in our history is more than 30, and reached more than 12 million people, including all ethnicities. And we utilize culturally sensitive and ethnically similar community volunteers in planning and implementation of creative program activities. The next slides will demonstrate some of this. The four strategies, the first and the next slide, the most important one, is utilization of transplant recipients, donors, candidates, and their families, along with healthcare professionals as effective messengers within the community. This may have been the first and most important finding. The next one, which is important as well, is that you deliver a culturally sensitive message by ethnically similar messengers who are known within the community. And then next slide, thirdly, we identified that community, grassroots efforts in the community to educate and empower them and let them take care of it and do the work themselves is a third and an important community action plan. The development of community action plans makes a big difference. And fourthly, is something that we've known all along. That is collaboration with all who would let us interact with them, especially the faith-based organizations, but eliminating no one. Next slide, please, shows that as a consequence of this, we developed that twofold solution, identifying prevention and intervention, as we mentioned. Next slide points out that the MOTEP model goes from training to program evaluation and research and culminates in increasing the number of donors and transplant recipients and decreasing the number of people who have end-stage renal disease. The next slide points out that this twofold solution was critical, and the slide that follows points out that we developed in 2001 a program to take care of yourself, love yourself, take care of yourself. We started that more than 20 years ago, recognizing that this is the beginning of everything. uh, Adopting healthier lifestyles. Next slide shows those behaviors that are associated with causing increasing the need for transplantation: diabetes, hypertension, alcohol and substance abuse, poor nutrition and lack of exercise, and finally obesity. All of these lead to the need for transplantation in the first place. Next slide, please, which shows that the people who were behind the scene, who made it all happen: Congressman Louis Stokes from Ohio, Secretary of Health Louis Sullivan, and then not last but not least, Dr. John Ruffin, the director of the Institute of Minority Health Disparities. All of these uh, allowed us to have the funds that were very necessary to support this MOTAP vision. Next slide points out exactly what the funding resulted in. Initially, from 93, 800,000, in 1995 to 2005, that 10-year period, $10 million, and then finally, uh, between 2006 and 2011, what we're going to talk about is the funds we got to identify how to reduce ethnic disparities in end-stage renal disease. And of course, the pivotal point is love yourself, take care of yourself. Next slide points out that this research center resulted in the creation of the Be Blessed model, which is a model that emphasizes the importance of biopsychosocial and spiritual aspects in health and wellness. Next slide, please. Which points out that this is the Be Blessed model, is the spiritual conceptual framework of health and wellness. And the interesting part, the next slide points out, is that it all began with understanding that what health is, because some people thought initially it was just the absence of disease or infirmity. But in point of fact, it's a state of physical, social, and mental well-being that gives you good health. Next slide, please. Because and what is interesting is how these models all evolved, and as we in the West consider, it all began, we think, the biomedical model of health, which of course is not accurate. Next slide, please. And as it progressed in the West, first that was it. Then the addition of biopsychosocial, and next slide, please, shows the addition of finally the psychosocial, and finally the spiritual model of health, which is interesting because all of this began 5 to 6,000 years ago and with the Egypt, of course, that's Africa, the continent of Africa, where it all began. Next slide, please, because the ancients recognized the biological and spiritual underpinnings of disease. And if you look at the last dot, you'll see that this actually preceded the biopsychosocial models by some 5,000 to 6,000 years. So while we think what we're doing with Western medicine is revolutionary, it's really we're finally getting back to where it all began in Africa, with the recognition that this biospiritual perspective really is what is important. Next slide, please. And so, in many ways, it's important to recognize that health outcomes are related to the whole complex of biopsychosocial spiritual domains. Next slide, please. And that shows the cycle. And then what we've identified then is be blessed, as we have here, which we'll look at in the subsequent slides, which is the eponym that we've used to describe the whole thing. It starts with biology. The B, biology is for biology and genetics. Next is the E, with environment, with the physical and the social, physical and the social. We now talk about social determinants of health as a new thing, but it's an old. Next slide, please, which shows the beliefs. B for the beliefs, which are critical. The belief system determines your health. Next slide, please, which shows the lifestyle. as we talk about, ounce of prevention is worth a pound of cure. Diet, nutrition, sleep, physical activity, avoiding bad habits. And then the next is experiences, the E for experiences. A reward and punishment history, daily life experiences. Stressful things harm you, pleasant things help you. Next slide shows the spirituality, which in the final analysis actually trumps almost everything else. Uh, we really believe that of the physical, of the spiritual aspects, the one that is more important than everything else is love, Love. And so we talk about spirituality, but when push comes to shove, it's belief in God and also love. Next slide points out the other S, which is stress. We people of color endure a lot of stress because of our complexions, and this affects us physically, mentally, and emotionally. Next slide, please, shows that the next one is emotions, whether they're positive or negative. Positive help, being happy and delightful helps. Being negative and being unforgiving hurts. Uh, Next slide looks at the last of the Be Blessed model as desires, the need state, your urges, your appetites. All of these come together to affect your health and wellness. Next slide, please, which points out that when you look back at it, it all began in the West with the African concept of the spiritual. We have finally evolved and gotten back to it. And when we looked at a community-based sample of 207, we identified those health outcomes that are determined by the dynamic interplay of activities across those 9 biopsychosocial spiritual domains expressed by the acrostic Be Blessed. Next slide, please, points out that in summary, as we looked at the uh, biological and physiological consequences of the BLS model, we found that looking at the lipid markers, look at the cognitive processes, looking at the cardiovascular functions, looking at the creatinine levels, looking at norepinephrine levels, blood pressure levels, inflammatory biomarkers, and psychological stress, identified ways in which BMS model actually helped you attain and retain a good health. The next slide, please, points out that lipids, looking at the lipids, look at the triglycerides, all of those related to your ability to think well. Also, inflammation biomarkers related to cognitive processes, all interrelated. Cardiovascular functions related also to cognitive functions, so that we are all one, but all of our body parts work together to help us become as healthy. Next slide, please. Which points out that all of these indices of self-related health positively related to the objective clinical findings, and that a negative mood uh, causes ill health, and religiousness, intrinsic religiousness, is positively related to good mental health. Next slide, please. Which points out that one of the most negative findings that we found is if you're able to forgive, it's positive. If you're unable to forgive, this is one of the worst things that can happen to you. And as a consequence, you have anger, depression, and high blood pressure. Also, we unmasked the fact that perceived racism is related to increased cortisol levels and is a real consequence of ill health in the lifetime and the workplace. Next slide, please. And I think this ends the presentation, but opens the floor for discussion of the ways in which we can affect our own health by loving and recognizing that the positive and negative aspects of life, in many ways, all depend upon us. And I therefore open the floor for any questions that you might have relative to the ways in which we have learned that things really began 5,000, 6,000 years ago in Africa, and when the Egyptians actually modeled and recognized that spirituality was the most important aspect of it. So finally, we in the West now recognize that and are adopting what they had used many years ago. Unfortunately, uh, the Western group thought that they had it all and tried to use everything else, but finally recognized, as we do now, that spirituality is where it's all at.
Dr. Callender, that was an incredible presentation. It was extremely comprehensive and really gave us some insight as to, as usual, how our ancestors tend to know more than we do at this point in our at this point in evolution. But I have to say that I have found, and I'm sure our audience members have, and I'd love to hear some insight with them, how challenging it has been these last 2.5 years with everything in order to keep our health center stage. We had the pandemic, we had the racial injustices with George Floyd and so many more, and how necessary it was for the BLM movement. And then, of course, stress from negativity from the news and social media, not seeing our family members because of COVID on a regular basis, not being able to worship and practice our religion of choice in person with fellowship and in the congregation because of COVID. And then also the fact that some people didn't exercise. A lot of people didn't exercise because their gyms were closed or they were afraid to go outside. And then their diet got poor. So I say all this to say that how do we recover, right? As you mentioned, spiritually, emotionally, mentally, physically, from these very challenging 2.5 years?
I think that's a very great question. And one of the things that we recognize now, but we have done little about it, is to recognize that it has affected uh, mental illness to a tremendous extent. Uh, Most studies indicate that the amount of anxiety, the amount of stress, the amount of depression has at least doubled over the last 2 years. And as a consequence of this, we need more help, not only from spirituality and belief in our God, but also to recognize the importance of uh, the role of psychologists and psychiatrists, because we now have an epidemic of mental illness. And this epidemic requires not only you to love your God and to love your fellow man, but also requires that you seek mental health uh, care. And whether you see a psychologist or a psychiatrist, uh, understand that uh, Christians and those who love God, whatever religion they are, whether Muslims or whatever, that they also need mental health care. So the stigma that has been placed upon going to see the psychiatrist or the psychologist, that's one of the most important things we've got to remove. Now, in the presidential address, Joseph Biden mentioned a need to emphasize mental health care. However, we need to do more than talk about it. We need to make it so that, for example, you can go to see a psychiatrist, and as you may know, that many psychiatrists and psychologists now require that you have to pay cash because the amount of money that the federal government pays for healthcare, mental health care, is so low that they require you to do other things. So one of the things that we might want to do is to try to get situations so that the what the insurances pay for mental health care is significant enough so that they are willing to take insurance again and not require you to pay cash, because that just about eliminates the ability of those people in the middle to get mental health care, which is becoming more and more essential as time goes by. As you mentioned, the negative impact of the pandemic is it goes beyond belief in terms of impacting the. It also impacts our ability to educate and get community education and empowerment, because Nowadays, at least as a consequence of the pandemic, the ability to go into the community and educate and empower face to face, which is one of the best ways of doing it. Social media is important and is great, but it's not as good as the face to face efforts, which have been negatively impacted by the pandemic. So these are some of the things that I think we can do. And now that the pandemic is slowing down, we need to get back out into the community to educate and empower them. Whether we do it in small groups or not, probably is better to start with. But doing the things that we used to do, going out into the community, having the uh, uh, clinics in which we do screenings and we do blood pressure checks and BMI checks. Those are the things that we used to do. We need to start doing them again. So that's my answer to your question.
No, that was very thorough. Thank you, Dr. Callender. I do want to get to one of our audience members' questions, Ms. Chantry. She asked a question: what are the symptoms of kidney infection in our bodies?
Well, one of the earliest signs of kidney infection is burning upon urination or cloudy urine. And of course, another thing that we need to look out for is if you have any blood in your urine. Uh, I think these are some of the earliest signs of kidney disease. Not to mention the fact that screening for protein may be one of the earliest signs of kidney disease, and that's why the Ron Joy Kidney Paul Foundation has been uh, obsessed with increasing kidney screenings because that's the earliest way to identify that your kidneys are failing. If you have protein in the urine, if you have bubbles when you urinate, this is one of the earliest signs of kidney disease.
Also, Dr. Callender, there's something that I have learned by working with you and Dr. Melanson, who's unfortunately unable to be here, who is our chief transplant surgeon for the GW Transplant Institute. You both have stressed the importance of making sure one controls their blood pressure so that when they control their blood pressure and it is at a normal range, their kidney disease is not amped up, so to speak. And what is a cause of high blood pressure, right? Obviously diet, but also stress. And we've touched on stress in your presentation. So did you want to also address the importance of ensuring that individuals are, if they're on blood pressure medicine, taking their medicine, if they have not gone to a doctor and gotten their blood pressure checked, that they do, and things of that nature?
Well, I think one of the things that sometimes patients recognize this, but sometimes the doctors don't, is that people of color have more stress than other peoples. And this then, as our study indicated, points out that this increases the blood pressure. The norepinephrine is increased, the cortisol levels are increased. And as a consequence, there are things that we need to do about it. One of them is to take the blood pressure medicine. But another thing that I mentioned before, but I'll mention again, is that yes, faith in God will help you much. But in addition to faith in God, the importance of going to your psychologist or psychiatrist and to let it all out because we get it in so many different ways. Studies across the globe identify that people of color are more stressed than any other group because our complexions are such that people tend to think if you're white, it's all right, but if you're black, you must step back. And this then is something that impacts our blood pressure as well as all other aspects of our health. And so this then requires us not only to have faith in God and believe, but also to recognize that going to a psychiatrist and going to a psychologist does not mean that you don't have faith in God. But God has given us these people of psychological knowledge to allow us to decompress ourselves and to participate in getting well again, mentally as well as emotionally as well as spiritually.
And you also mentioned not only the need for spirituality, but you also mentioned meditation, which takes down the level of your stress, and it is a form of exercise too, right? Yoga, people do hot yoga, they do yoga as a way. I've seen people lose a lot of weight, so it really is truly an exercise. But just as you mentioned, when you exercise, you do alleviate your stress level because right the endorphins are released and you're happier. So not only is exercise a great method and mechanism to lower your BMI and to be healthy, but it really does lower your stress level as well.
Well, and I think the point that you made is an excellent one because we will often talk about exercise and the role it plays. We do not often talk about the role of meditation. But I think the combination of exercise and meditation, and there are others who talk about the role of acupuncture as well as meditation and yoga and those kind of things. But I think uh, it is infrequent that we really recognize how important meditation can help you with the stresses of life. And there are many. And of course, those stresses have been doubled or tripled as a consequence of the pandemic. And therefore, the need to incorporate exercise as well as meditation. Not only does it help with that, it also helps your brain as you sleep to relieve yourself of the poisons that develop through the day. And this then is part of the reason why it is also recommended strongly for those who age and who are in danger of developing dementia. And meditation as well as exercise now are components of health that are improved by utilizing those resources.
Dr. Calendar, we do have another question from our viewer, Chantry. Does the kidney infection has to do with chest burning sensation or lots of gas in the stomach, leading to belching?
Kidney infection has nothing to do with that. Those are different situations that usually relate to uh, gastric reflux. And there are medications that are good for that. Of course, one of the most important things to recognize is that chest pain could be an indication of a heart attack. And so you do need to see your physician or cardiologist to make sure that it is gastric reflux. But gastric reflux is more commonly the source of the chest burning sensation and all of the things that lead to belching. And that, of course, is dealt with by a gastroenterologist who can look down in your stomach and see whether you've got gastric reflux, and and that can lead to many other problems. But kidney infection does not cause those symptoms itself.
Okay, thank you. Another viewer of ours, Michael Stevenson, has a question about, and I've actually had this question asked of me when I've been in the community giving screenings. So great question, Michael. Does kidney infections relate to the back, like lower back pain, internal pain, though? That's his question.
And the answer is yes. Very often, one of the one of the signs of a kidney infection is back pain that is aggravated by pushing on the back. And so lower back pain can be caused by many things, but acute pyelonephritis or kidney infection can cause lower back pain. Of course, there are other causes of lower back pain, as sciatica and uh, lumbar disc disease. But actually, pain in the middle of the back is more likely to be related to a kidney infection.
Okay, thank you. We have another question from Barbara Chambers Porter. She asks, "What about the new kidney meds, Farxiga and Caridian? Are they effective?"
I'm not very experienced with those two drugs, but and I think that kidney medications, for the most part, are effective if they can reduce the blood pressure and eliminate infection. I think I'm not. I can't answer the question about specifically about for Farxiga and Caridian, uh, and I can't really answer your question as to whether they're effective or not because I don't know much about them.
Okay. So Dr. Callender, for people that are listening in and they want to know how do they ensure that they don't have early stage kidney disease? We've talked about screening for proteinuria, which is, protein in the urine, but um, you have mentioned how important it is to be our own advocate, a patient advocate. And that is by going to, I want you to talk about when an individual visits their primary care physician, what they should ask the doctor for, what test, and then what to look for when they do the blood work.
Well, one of the, and I think it's a good point because, as you pointed out, we should be our best advocate for ourselves. And so there's certain things that you would want to know about yourself. For example, one, what is your cholesterol level? What is your hemoglobin level? What is your blood sugar level? Uh, what is your blood pressure? What is your heart rate? Uh, for example, if your blood pressure is higher than 130 over 80, then it's important to recognize that you have prehypertension. And so that may require medication, or it may just require dietary changes, elimination of salt and sugar, and also may require more meditation and more exercise. And I think those are the things that we can change. Lifestyle changes. Of course, we haven't talked about the role of being overweight. Obesity is one of the commoner causes of kidney disease. So we talk about high blood pressure, diabetes, uh, and substance abuses, and smoking, and alcohol use. And so all of those are important. But as you try to think of the way that you modify your lifestyle to decrease the likelihood of that, you have to understand that there's much evidence that indicates that your diet plays a major role, and that the less red meat you eat, the less sugar you eat, the less salt you take in, the more plant-based foods that you eat, the more fruits and more vegetables, uh, liberal water intake. All of those things play a major role. That's why an ounce of prevention is worth a pound of cure. And so this then is the message I would bring, that be careful about the food you eat. Uh, Try to eat less red meat. Try to eat less sugar, less salt, and I think that along with physical exercise of more than 150 minutes per week, and of course that's just the minimum. So that going to 300 and 450 minutes per week is good. And the exercise is important to not only be the walking, but also weightlifting, so that a combination of the cardiovascular uh, issues like walking and jogging and the like, along with weightlifting of 10 to 15 to 20 pounds, all together, along with the meditation, are ways to not only prevent you from getting kidney disease, but also from getting cancer. And so, as we look at the number one killer in the United States, it's of course cardiovascular disease, heart disease, and all of this is contributed to by high blood pressure. And so, an ounce of prevention is worth a pound of cure. So, healthy diet, exercise, and meditation, you cannot overestimate the importance of them. And then, of course, when you add to what we talked about, loving yourself, take care of yourself, spirituality, uh, having social interactions, uh, interacting with the power that be, the power that created us, and then love. And then, of course, we talked about the importance of forgiveness. Can't overestimate how important it is to be able to forgive and to love. And when people talk about that, they think it's just uh, uh, play on words. But the ability to be able to love yourself and to forgive others for what they do to you is an important, an additionally important way to stay healthy.
Those are extremely wise words and sage advice, Dr. Callender. Thank you for that. We do have a few other questions from our audience members. Michael Stevenson has a follow up to the last question about the lower back pain, asking if it is his direct result from his kidneys, perhaps. Asks, are there other methods in which we can protect our kidneys that we don't have to take, like other medicines? I know you just touched on diet and exercise. But is there anything else that the average person can do to protect their kidneys?
Well, I think one of the most important things to do is to drink 1 to 2 liters of water a day. And I think as long as you're taking enough water that allows your kidney, your urine to be yellow, I think you're good. When it starts to be brown, that suggests that you're not taking enough fluid. So that liberal fluid intake. And then, of course, the other suggestions that we made relative to avoiding red meat is good for everybody. As we mentioned, the impact of red meat and ultra processed foods on the influence of cancer. But in terms of kidney per se, the keeping your blood pressure under control, keeping your diabetes under control, keeping your weight with a BMI of less than 30. Actually, ideal is BMI of 25. I think are the ways in which we can do what we can. And when I say love yourself, take care of yourself, I mean it. I mean it. And I think that all of the things we talked about today, diet, exercise, meditation, uh, as well as having a positive attitude and being forgiving. All of those things allow you to be healthy and prevent cardiovascular diseases and kidney disease.
Wonderful information. So, another question we have is, how does my doctor know that I need to have dialysis or get a transplant?
Uh, there are certain tests that tell you. For example, if you have BUN, blood urea nitrogen, where we talked about things you need to know. Your blood urea nitrogen should be between 15 and 25. Your creatinine should be about 1 or less than 1. And so when your BUN gets over 40, when your creatinine gets over 2, these are indications that your kidney is failing. And this happens long after you get protein in your urine. But so those are the blood tests that your doctor gets to know. And so when you have a creatinine clearance that is less than 20, the normal creatinine clearance is 100. And so when you get down to the point where your creatinine clearance is less than 20, then it's time for uh, artificial kidney or kidney dialysis uh, or kidney transplant. Uh, and, uh, uh, and what other foods should you avoid? I think the foods that you should try to avoid are, frankly, red meat and salt. If I had to pick two, those are the two things that I would suggest that you cut down because they negatively impact your blood pressure and the commonest cause of kidney disease are high blood pressure uh, as well as diabetes and obesity. And so that's my answer to your question.
Okay, that makes a lot of sense. I've also heard that you should obviously avoid fried foods at all costs too. Fried foods.
Well, yeah, fried foods are not good for you, and they increase your cardiovascular disease. So we talk about decreasing the meat, but also fried foods and are thought to be very harmful. As we look at the things, of course, the other thing that people won't like to hear this, but artificial sweeteners are not good for you either, and diet sodas are not good for you as well. And so that relying on fruits and vegetables plays a major role in your health. And so that's what I would suggest.
Okay, wonderful. I do not see any further questions. I did want to tell you, Dr. Callender, that one of our audience members truly appreciates everything that you have said, all the sage advice you've given, and they pray and hope that we continue to just have strength, love, and peace during these times. Okay, one more question. Great. Is there a way for a person who just started dialysis to improve? Great question, Cass.
Well, I think you got to remember that once you started dialysis, it depends upon what caused the kidney problem in the first place, because there are kidney diseases, acute kidney uh, injury, which can improve. So if you have an acute kidney injury related to medication or poison that you took, or even a kidney infection, so if you have acute kidney failure, that can resolve. Now, if you have chronic kidney failure, it is unlikely that you will get off of dialysis. But the way you can uh, do well and perhaps even thrive on dialysis is by adopting healthy lifestyles, the same healthy lifestyles that we talked about before, meaning emphasizing plant-based diet, emphasizing decreasing the red meat and the fried foods that you mentioned, and uh, having a plate full of vegetables and fruits, and minimizing the amount of red meats and fried foods that you eat. I think, and then of course, uh, once you get on dialysis, there's certain uh, elements that you need not take, because potassium, for example, is not good to take for somebody who's on dialysis. Oranges are not good because they have a lot of potassium. Bananas are not good because they have a lot of potassium. Uh, uh, Salt is not very good because it increases the blood pressure. And of course, the sugar, of course, in diabetics. And of course, so the advice is to keep your diabetes under control, normalize your blood pressure, uh, 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 exercise, meditate, and I think those are steps that you can do. And then you follow your doctor's instructions, because they will tell you how much fluid you should take and how much salt, because we usually have a restriction of salt and protein. And so these are the things you can do to help uh, as you wait for your transplant, if you want a transplant, because that's probably the treatment of choice for somebody who has chronic kidney disease. I mentioned again, if you have acute kidney, then you try to do what the doctor tells you to do until the acute problem resolves itself, because at that point you may no longer need dialysis. COVID has been a cause of kidney disease, and for some of those patients, as the COVID goes away, the kidney function returns. So it's not a death sentence for those if you have acute kidney disease, but if you have chronic kidney disease, the best out is a kidney transplant. And while you're waiting, is to follow the doctor's orders relative to the fluid intake, salt intake, and protein intake that you have.
Okay, thanks so much, Dr. Callender. All right, I am not seeing any other questions. It is 2:50. I want to thank Dr. Clive Callender for his excellent and comprehensive presentation on healthy living and spirituality. Love thyself, heal yourself, and love yourself. Um, all right, one more question, and that's it. Does excessive exercises cause any harm to our bodies?
That's a very good question, because there have been data that suggest that yes, you can do too much of anything. You know, moderation is the key. And so when you get in excess of more than 700 minutes per week,
Wow.
there's some evidence that that can harm your body. Uh, uh, but I think that a rule that is good for exercise is when you have pain, you should stop. So you exercise to the point of when you have pain. When you have pain, that suggests that it's time to stop and to rest and recover. So that excessive exercise is just as excessive eating, excessive anything. Moderation is the key to success and to good health. And excessive exercise and going over 700 minutes per week can be a source of harm to your body.
That is fabulous. I did not know that in terms of that there was a limit. Not that I've ever reached it, but I say that because that's good to know. So it should be more than 150 minimum. You had said
Yes,
in this presentation, and truly no more than 700.
right. And anytime you exercise to the point of pain, it's time to stop.
Well said, Dr. Callender. Thank you so much, Dr. Callender, for this very important presentation. We encourage everyone to rewatch it again or send it to a loved one or a friend. This is sage advice, especially for today's time and you know what's going on. We really have to take care of ourselves, right? You can't take care of anyone else unless you take care of yourself. So be good to yourself, love yourself, heal yourself, as Dr. Callender has given us some great advice on methods on how to do that. We will be back here in 2 weeks, Friday, July 22nd at 2 p.m. for another edition of Kidney Talks with the GW Ron and Joy Paul Kidney Center, MOTEP, which Dr. Callender founded, which you learned about today, and the Pennsylvania Avenue Baptist Church. Dr. Callender, thanks again. I'm wishing everyone a very happy and healthy weekend. Take care, and we'll see you again.